Hi, my name is Jose and this is Eddie, and today I'm doing an abdominal assessment along with a reflex assessment. The first thing I want to do is I want to expose Eddie's abdomen, and I want to look at the characteristic, the contour, the pulsation and movement of his abdomen. Next thing I want to do is I want to auscultate for bowel sounds in all four quadrants. Right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. And if I didn't hear any bowel sounds, I will listen for an additional 5 minutes. Next thing I want to do is I want to auscultate for the aorta. Right renal artery, left renal artery, left iliac artery, right iliac artery, right femoral artery, and left femoral artery. And what I'm listening for is any bruits. Next thing I want to do is I want to percuss the abdomen in the four quadrants. And I want to listen for the sounds, whether it's timpani or dullness. Next thing I want to do is I want to percuss for the liver borders. I want to go mid-clavicular, starting with timpani, moving my way up till dullness. Which would be there, and I would mark it. Starting mid-clavicular again, on the lung resonance, I'll move my way down until I hear dullness. Which would be right there. I would measure, and it should be between 6 and 12 centimeters, and his is about 6.5. Then I want to percuss for the spleen dullness. So what I want to do is, again, just posterior to the mid-axilla, starting with the lung resonance and working my way in all directions until I hear dullness. Which would be right there. Next thing I want to do is I want to do light palpation in all four quadrants, no more than 1 centimeter in depth. And I'm feeling for any masses or any abnormalities in the abdomen. And I also want to take a look at his facial expressions for any signs of pain. Next, I'm going to do a deep palpation of his liver. And what I want to do is place my hand on the 10th, 11th posterior of his back. Have him take a deep breath and put my fingers towards his head. And then on the side here, parallel. You could go ahead and let your breaths out. Any pain or tenderness there?
No, sir.
Okay. Next, I'm going to palpate for his spleen. Let's go ahead and take a deep breath. Up against his left costal margin. Okay, you can let it out. The spleen is usually non-palpable. After I palpate his liver and spleen, I want to palpate his right kidney. Go ahead and take a deep breath. Let it out. Okay. Okay, now on his left side, take a deep breath and let it out. Okay. Next, I want to palpate for his aorta for any pulsations. So I'm going to go midline to the left. Okay, that's good. And I didn't feel any pulsations. If I did feel a pulsation, there would be signs of an aortic aneurysm. Next thing I want to do is I want him to bend your knees. Okay, bend your knees just like that. And then lift up just your head. And I want to look the abdominal muscles, seeing if there's any bulging, because it could be a sign of a hernia, and I didn't see any. Okay, that's good. Go ahead and sit up. Lean forward. The next thing I want to do is I want to test his reflexes, starting with the brachial. I noticed his finger twitch, which is a good sign. Again, I've noticed brisk movement. Then I'm going to move on to his knees. Hyperreactive.
Yeah.
Again, hyperreactive. Then I'm going to do his Achilles. Striking the hammer on his Achilles tendon and noticing a twitch, which I did. Now the other one. Positive. And that concludes my assessment. Thank you.